Today, I want to address a complex situation. Children with food allergies or following restricted diets face unique kidney stone risks that many families and healthcare providers don't anticipate. The dietary modifications necessary to manage allergies or conditions like celiac disease can inadvertently create nutritional imbalances, promoting stone formation if not carefully managed. Let me walk through specific scenarios. Dairy-free children, whether from cow's milk allergy, lactose intolerance, or vegan diets, often miss calcium-rich foods. Paradoxically, low dietary calcium actually increases stone risk through a compensatory mechanism. When dietary calcium is insufficient, the gut absorbs more oxalate from foods because calcium isn't there to bind it. Soy-based milk alternatives contain high oxalate, so children replacing cow's milk with soy milk may increase stone risk. Nut-based milk products, almond milk, cashew milk, are concentrated in oxalate. Common dietary patterns creating risk include children with cow's milk allergy relying heavily on soy products and almond products for calcium and protein, getting cumulative oxalate exposure from these alternatives. Celiac patients consuming gluten-free processed foods often encounter high sodium and numerous additives we've discussed. Vegan children can develop imbalances in calcium, vitamin B12, and other nutrients affecting kidney metabolism if their diets aren't expertly planned. Let me explain the calcium paradox more fully because it's counterintuitive. Adequate dietary calcium actually reduces stone risk by binding intestinal oxalate and preventing absorption. Most kidney stones are calcium oxalate, leading people to assume calcium causes stones, but it's precisely the opposite. Calcium restriction or reliance on calcium supplements rather than calcium from food affects this protective mechanism. Food sources of calcium provide better protection than supplements because the calcium is consumed with meals where it can bind dietary oxalate effectively. Providing nutritionally adequate alternatives requires expertise. Calcium-fortified options with lower oxalate exist. Rice milk fortified with calcium provides calcium without the oxalate of soy or almond milk. Balanced plant-based eating for vegan children requires careful planning with pediatric dietitians to ensure all nutritional needs are met without creating excessive intake of any stone-promoting compound. Working with healthcare professionals experienced in pediatric nutrition and restricted diets is essential, not optional. I've reviewed success stories of families managing multiple food allergies while preventing kidney stones through meticulous planning. One case involved a child with milk, egg, and tree nut allergies who developed calcium oxalate stones. Medical nutrition therapy identified that the family's dietary choices, soy milk, soy yogurt, soy-based snacks replacing dairy, created oxalate overload. Switching to fortified rice milk and oat milk, incorporating calcium-fortified foods, and balancing the diet prevented stone recurrence while still managing all allergies safely. The healthcare team approach is crucial for these complex cases. Allergists manage the allergies and define safe foods. Gastroenterologists handle celiac disease or inflammatory bowel conditions. Dietitians develop nutritionally complete meal plans that avoid allergens while preventing stone formation. Nephrologists monitor kidney health and advise on stone prevention strategies. These specialists must communicate and collaborate, not work in silos. When necessary internal tools aren't available, when families lack access to pediatric dietitians or specialists, outcomes suffer. If you're managing food allergies or restricted diets and don't have specialist support, advocate strongly for referrals. These situations are too complex for families to navigate alone without expert guidance. The consequences of getting it wrong include both allergic reactions if allergens are reintroduced inappropriately and kidney stones if nutritional balance is lost.